I'll just sit here and smile while you're
Okay.
ready.
I am.
I realize these beginning parts are actually recorded too.
Yeah, they are. Yeah.
And not at all awkward. Hello, everybody. Here they come. All right, we're just gonna wait a few minutes before we get started here. Hi, Mike Sevilla, our famous doctor from Ohio. Nice to have you here. And everybody else that's famous, also in Wilson County and everywhere else. Hi, Mike Aldridge. Man, look at this crew. Jake Dugan, who wishes he was still here in Fredonia. Come back to us, Jake. All right, Margaret and Lisa. It's great to have everybody. Kathy, she's been a regular with us. Thank you.
I don't know why it's not letting me share this, but
Okay, is that all right? Okay, we'll still be able to see it.
it's trying. I don't know why it's doing it.
So it's 4:30. We'll see if people can sneakily watch while they're at work or while they're supposed to be teaching their kids or whatever
Whatever they're supposed to be doing.
yeah. Or just blatantly watching with no shame whatsoever. All right. So we will go ahead and get started if that sounds all right. And as usual, we will introduce ourselves. So I'm Jennifer McKinney, and I'm the Wilson County Health Officer.
And I'm Destiny Wheeler. I'm the Wilson County Health Department Administrator. It's a very long title.
It is a long title. All right. Well, we are here today because, as you probably already know, we do have our first positive case of coronavirus or COVID-19 in Wilson County as of yesterday. And so we're going to kind of, we're here to just answer any questions, really, and we're going to kind of go over what things we need to know for the future. So we have one rule for today. It's like Fight Club, we don't talk about Fight Club, but in this case,
we don't talk about the patient. The HIPAA prevents us from giving out any identifying information, and our patient, who is actually recovered clinically from her illness, is protected under those rules, and we don't want to infringe upon her privacy. So
I think that's actually a great place to start with. People often will ask, what do you mean she's recovered? So let's go over that first.
Yeah, so there are 2 criteria that you have to meet to be recovered from the illness. It has to be at least 7 days since the onset of your symptoms. And you have to be fever-free for 3 days without medication, whichever is longer. So we aren't going to say someone recovered in 4 days, because we have to give them at least that 7-day window. Mm-hmm. Yeah, so it's 7 days plus at least, however many until they're fever-free.
Alrighty. And so when they meet that criteria, we do call them recovered at that point. Now, after they're recovered, we still are very careful with them. We want them to wear a mask. We want other people to be careful around them. Because this is so new, the world was introduced to this really in all of its full glory back in November. So we're trying to gather all the information we can, and we want to be as safe as possible. So we don't want to be surprised later and say, oh, actually it was 9 days of, whatever. But what we're seeing around the world is that 7 days since the onset of symptoms and three days being fever-free. So we're going with that, and then we continue with the precautions after that.
Mm-hmm.
All righty. Yeah. And we do appreciate, we have all these people that come on and say hello and say hi. We want you to know that Destiny and I go back through it afterwards, and we're so excited, so we go and like them. And so we love people saying hi to us, so thank you. We want to know that people are watching. If we want to be useful for you all.
Yeah.
So do that first.
Yes.
Yeah.
So the health department's been really busy. We were contacted a little bit after 4:00 yesterday, and I know we keep saying that, but we're prepared. We've been prepared. We've been waiting for this, and it's true. We had a press release out in less than 30 minutes, and I was actually at home when I got the call. So I came all the way into town, and we still were able to get that press release out in around 30 minutes. So that was really, really great. That's how prepared we were. We had everything pretty well ready.
And Destiny and I recorded a video and had to read a lot.
Yeah, we actually
So-
recorded that video like 3 times
Yes.
because we kept misreading. So since then, we have put a pretty good graphic on the health department Facebook page. I have to give a shout out to Saline County Health Department. That's where that came from. Their PIO developed it, and their public information officer developed that. And what the graphic goes through is how the investigation process works. So first, we're notified. In this case, we notified the client and kind of start contact tracing. So we go back through their last 16 days and figure out who they've been around, who they've been in contact with. And as you remember, it's within 6 feet for 10 minutes. We did all that, and then we start contacting their contacts and give them information and give them their quarantine details and make sure that they're not symptomatic. And then we continue to monitor those contacts until either their incubation period is up or they become ill and get tested. And that's basically the whole process. There can be a lot of contacts or there can be just a few, and social distancing is working really, really well here. So in this case, we did not have a ton of contacts, so that was great. The investigation did not take a terribly long time, and in the event that someone has not been social distancing and has been, going to friends' houses or neighbors' houses or hanging out or whatever, there could be potentially many contacts. So that's another. I know that on Facebook I've seen those little posts that say, if public health calls you and wants to know how many people you've seen in the last 14 days, will you be embarrassed to tell them? And that's why those posts are out there, because that is how we determine who we call and who we quarantine.
And I mean, it takes everybody to do their part, because it really only takes one person to maybe do what they're not supposed to be doing for things to happen. We're not saying that happened by any means in this case, but we're just saying that if people, that's why it made this case, again, we're not going to discuss the details of it, but it made this case easier to be able to track everybody because the people involved were doing what they were supposed to do. So that's what we're hoping for. When people, when people are asking, okay, well, we've got coronavirus now in Wilson County, what do we do? The answer is we do exactly what we've been doing, and it's like, this is not a drill, people. This is what we've been training for. Everything we've done up to this point, it's been in Kansas. Coronavirus has been in Kansas since March 6th. Since that first week, we started talking about what kind of precautions we could take, hand washing, social distancing, that kind of stuff. And you guys have been doing it, and that's the amazing part. And we need to keep doing that, and that's the only way that we can keep these numbers low. Sure, it's here. It doesn't mean that it has to be widespread throughout the whole community. And the ways that we're going to continue to protect ourselves and protect each other are exactly what we're already doing. So please keep it up. We know that there are still people gathering, in bigger groups. Please don't. This is our plea. Please don't do that.
Please don't.
We know that there are still in-person services for churches. I'm going to say please don't, because there are so many people who are celebrating their religion in so many ways, and they're beautiful and they're safe for everybody. And so we're going to come out and just say these things. Please be safe. Please don't do the things that we've been advising you not to do, because that's going to make any future cases more difficult, and it's going to make it more likely for it to spread throughout the community. So we're asking you to wear those cloth masks. We're asking you to stay 6 feet away from each other. Don't do non-essential travel, and just do the things that you can do to protect yourselves and protect others. In this case, like we said in our press release, that there was a 90-year-old woman, what a miracle that she was able to recover, and that again is a beautiful thing. That hasn't been the case all over the world and all over the country, or even in the States. So we have to protect those that are the most vulnerable. Is there anything there?
So we have a question here about what precautions should we take that we're not already taking, and I would say that if you're practicing the social distancing, if you're following the stay-at-home order, if you're washing your hands, wearing a mask, those are the things that we need to continue to do. There's really nothing new or novel that we need to address because we've been nagging.
We have. Have you noticed? We keep saying
we try to nag nicely, but we try to repeat those things because those are the really important things that will stop the spread or slow the spread of this virus.
Because there's no treatment for coronavirus, the best thing we can do is prevention. And so that's why we keep saying this, and everybody around, because the best way that we've seen less deaths happen and less illness happen around the world is doing exactly what you're doing already. So thank you. Thank you.
And there are some questions about how can you be recovered if you didn't have a fever, and it's still the 7 days. So it's going to be at least 7 days no matter what. If there's never a fever, which is
fine. Like it happens.
It happens. Yeah. Yes. Yeah. Then it's just 7 days from onset of symptoms. And I mean, we want your symptoms to be lessened. We want you to feel better. And then still wear the mask just to protect others after that. And then there was a question about if someone tests positive, when would they return to work? And it would be after that clinical definition of recovery with a mask.
And then they keep wearing masks afterwards. So and work with your employers, because our employers have been very good. I can speak for Wilson County. We can speak for Wilson County that we've had employers reach out to us to develop their policies because they want to be proactive as well. And so they know what's going on. They'll work with you. If they aren't for some reason, come tell us. We'll help in any way, but we want to make sure that when you return back to work, that everybody around you is safe and everybody feels comfortable about it. There was a question with that with the recovered part if they need to test negative. So that is one way. There are two ways to be considered recovered. The one way is what we've already talked about and Destiny just mentioned. The other way is to have two negative tests done 24 hours apart. But because we have a testing shortage, across the country, then we would recommend that we do the other way because we don't want to use those tests just to prove that we're negative. So, alrighty. I touched my nose. Oh, so close. All right. Somebody asked about pending tests. How many tests are there pending? We were initially, when this all started, we were reporting pending tests because it was easier to keep track of. And it's not like we have hundreds out there by any means. In any given day, there's maybe a handful of them, right? So, less than 10, maybe I don't know actually.
I don't
know.
So
the tricky part is, we run tests here at Fredonia Regional Hospital for other hospitals in the area, even out of our county. And some of our patients who live here in Wilson County will get tested in other counties if they see a doctor somewhere else in another county. So it's hard to no. They're all communicating. The health departments are communicating. So if somebody's tested from Wilson County, but they're tested in, let's say, Montgomery County, then they let Destiny know so she can also track them. But to be able to say which tests are pending, and then some go to the state, some go to private companies, there's different private companies, it's really hard to say. There's just not a whole lot out there.
And it was really, the numbers didn't make a lot of sense. So it looked like we were like testing a whole bunch of people, but it's not necessarily we're testing all Wilson County residents, and it was just, the numbers didn't make a lot of sense. So we're just reporting now on the results of the Wilson County tests.
So there's a question about if our patient already recovered, how did we not know about her results sooner? So it's a great question because Destiny and I, like we always mention, we keep an eye on social media because we want to know how people are feeling and make sure that we're taking the temperature of our community and we know what questions are being asked. We did not get the results until yesterday at almost 4 o'clock.
A little after 4, yeah.
So we didn't have the results either. No one had the results. The results were being run. That's the thing with testing these days is that although we would like to have the results within 24 hours, and some places have the 45-minute test and whatever, even at the state level, when we send stuff there, it's not really getting done within 24 hours. And some of the tests are taking up to a week long. And it depends on, it gets sent off to the company, and then they have however many tests that they have, and they're running all of these tests, and then that determines how long it takes. So we're not reporting every test that's pending, right? So you wouldn't know that a 90-year-old woman was tested, because again, for privacy reasons, we don't tell everybody whose test is pending. But like we said, she was in the hospital for a time, and she had actually met those criteria for being recovered.
She was in the hospital in isolation. And
the healthcare workers that were taking care of her were treating her as though she had it, which we have said we do every time that we have a test pending and a person hospitalized.
Yeah.
Or a person being tested, for that matter.
Yeah. Once a patient becomes a suspect case, which means they get tested, they would be in isolation until they recovered, and that was the case in this case.
And then a question was, does the number go back to 0? We would love it to go back to 0, but right now they're still counting. It's cumulative numbers, so we don't get to take away our numbers. There was one that I was just going to say. Oh, as far as when we're talking about like why doesn't the public know about every person that's out there with a pending test? Privacy reasons. We have read, and again, this is because we're being straight up with you guys. We have read that people think that we had the results early. People are saying that that the testing was done before or earlier or later than what we said, and it's strange because it's legal medical records, and so we are just going off of those. We know how the timeline went. We're only giving you the information that we have because that's all we can give you, but we're giving you all the information we can give you, and so please know that we're doing this and we're doing our daily updates and we're doing as much as we can do to be as transparent with you guys as possible, because we are all in this together. Like we've said, we see no benefit if we hide anything, and so we are going to tell you everything that we know. So please share that with people. We're here to tell you. I mean, look at us. We're not even good at making other stuff up. We just spew it out.
Yeah,
we just say whatever.
Yeah, it tends to bring more comfort to be honest than to hide things. And so we're not interested in hiding a bunch of things from you guys, because
you guys are our friends and family.
Yeah,
we love you.
Yeah, we want you to trust us, so we're going to tell you the truth.
Yes, we're probably going to tell you more than you want to know, even.
Probably.
Yeah, you'll probably just want to turn this off. Just kidding. Okay. So someone asked about the patient's symptoms. I don't know that we can get into those details about the patient themselves and everything that was involved with the symptoms.
Not really.
But we will say that, and there was another question about what if they don't have symptoms? So sometimes that's the case, is that people might have that's the tricky part about this, is that sometimes the symptoms that people have are just a cough, and there's allergy season right now and everybody's coughing and having a runny nose, or
they're just sleepy.
Or they have a headache, and they don't have a fever, or they do have a fever and nothing else. This is why this is a bad virus. So so people usually, just to kind of review symptoms, people usually will develop symptoms anywhere between 2 and 14 days, usually not in that first 24 hours, and on average a person will develop symptoms within 5 days. Most people will develop symptoms within 5 days, and 97% of people will develop symptoms by 11 days. So that's why there's that 14-day quarantine. We should get everybody in there that's going to develop symptoms if they're infected. But you're right, some people will not develop symptoms. That's why we're pushing the masks and everything to keep your droplets in, because who knows if you're an asymptomatic carrier. I mean, you could be. Let's all treat ourselves as though we could have it, and then that will allow us to protect other people too.
Someone asked about false negatives on the testing. False negatives can happen when you're testing asymptomatic people, people with no symptoms, because So say I come in contact with COVID-19 or with the novel coronavirus, then I get just a little bit of that virus in here, in me, and then it's got to build up to the point that the test will register it. So if we're testing people that don't have symptoms, then they could be carrying the virus around, but not have enough to register on the test. So false negatives do happen. That's why when you go to your doctor, they're likely to only test you if you're symptomatic or if they know that you've had contact with a COVID positive patient. And even then, you're probably going to be in isolation, and then if you develop symptoms, then be tested. Just because of those false negatives, we don't want to give people a false sense of security that, oh, I don't have it, and then they end up having it, and then 3 or 4 days later, they develop symptoms, and they've been shedding virus for 3 or 4 days. So that is kind of the skinny on false negatives.
Destiny says things like the skinny. I just want to point that out.
Yeah.
But yeah, absolutely. And so if you have a high suspicion, like protect yourself and be careful.
Oh, sorry.
I was gonna make sure we didn't have. I do have to say hi to. We have a visitor from England, actually, a friend from England. So hi, Kieran. Thank you for joining us. Okay, we did that. Did we do that one? What does recovered look like?
But if people aren't having symptoms, what is the protocol?
So kind of we talked about asymptomatic.
Yeah, can symptoms reoccur?
Can symptoms reoccur? So this kind of goes back to the idea, so symptoms, yes, can reoccur because we have so much going on. The symptoms of all this are the same as allergy, sinus infections, other respiratory infections like rhinovirus, parainfluenza virus, and all those that are out there every year anyways. So definitely those symptoms can be around. Now, whether or not that's coronavirus is the question. Initially, we thought that once people had it, they would develop antibodies and then they would not get it again. You would be immune. Now, that may not be the case. We're trying to get the numbers from all over the world to see what that looks like. So if you do have it, you still have to continue to be careful.
Hair thing going on. My hair's sticking up. My hair was sticking up.
It's okay. It looks great. It looks good. So you have to continue to be careful because we don't know at this point if you can get the disease again. We are seeing that happen in some places. In general, hopefully people develop the antibodies and then we don't have recurrence of infection. Isolation the whole time, risk 0. Okay, that was the testing, negative testing. Oh, one thing, as far as false negatives, we do, when we do get a positive, it is very likely positive. It's like 99% almost, that it is positive. So when you get a positive, you're not likely to get a false positive. Time for a weird face? Okay. Alrighty, thanks Diane for the reminder.
Okay, if someone would come into contact, you are the ones to contact who needs to go into isolation. So most of the time we'll contact you. Mm-hmm. So when we get, and this is, so when we get a positive result, the first thing that we do is we contact the positive patient, the COVID patient. And they give us a list of all the people that they've come in contact with in the last 14 days, and then we call all of them and we track them down and we try and get them into quarantine. So usually we'll contact you.
And along with that question, I think the follow-up was that in an office setting, if there is someone in that office that's a positive, what happens then? Because it can live on surfaces. We do know that that's the case. Ideally, we are able to clean the whole place down, right? So we kind of shut her down if we can, even for 24 hours to do a good cleaning and make sure all the surfaces are covered. I don't think we're required to do that, but if you can do that, that's great. Mm-hmm. Remember that it always goes back to exposure. So even if you're in the same office building or in the same office as that person, but your desk is across the room, that doesn't mean that you're exposed necessarily, especially if you guys are kind of doing your thing on the other ends of the office. But if there is significant contact, then and you spend a lot of time in the same area, then you will probably be asked to quarantine at that point.
Yes. Yeah. Now, if you are a contact of a COVID positive patient, and you work in an office, then you would be asked to quarantine, but your contacts are then contacts of a contact.
And are those contacts?
They are not. So Jennifer and I work in the same office, and Jennifer came in contact with someone with COVID-19, and she has to be quarantined. So I do not. So it may be me cleaning the office. I would want to take precautions. I would want to wear a mask. I would want the gloves and all that. And but I wouldn't necessarily have to be quarantined just because I'm her contact.
Yes.
Can you carry the virus home on your shoes?
Yes. So can you carry the virus home on your shoes? Yes, in theory. If you, if there are droplets on the floor, you step on the droplets, then you have the droplets on your shoes, and then you go home. Again, it's all in theory because we know it's all transmitted by droplets, and so anything a droplet can stick to is where it can be. So especially if you're a healthcare worker or you're someone who just, or who you found out that like in an office setting that someone was COVID positive, wash your clothes, maybe bleach the bottom of your shoes. I mean, it's very unlikely still, because imagine you're walking home and you're stepping on lots of stuff and things it's still a virus. It's not, also it's still not invincible, so it's going to be rubbing off on the ground or wherever else you stepped, and so but you don't want to be able to track it home. So if you can, get out of your clothes, get out of your shoes, and then change into new clothes and wash your hands before you're around your family members.
Yeah, and especially, I would think, and this is just because I'm a mom, if you've got little ones that are on the floor a lot and you have like a lot of hardwood or linoleum or whatever, I would take my shoes off and like carry them inside and sit them down and then wash my hands.
Yeah. True.
Just so I didn't track it across the floor, just in case.
And Destiny's not that good of a mom, so
I'm not,
that's
and
really,
the fact that I even thought of that is amazing.
Sometimes we forget about our children. So okay, awesome. Alrighty. So
you're welcome, Kayla.
I know. Somebody had asked about did the numbers in Kansas jump because Johnson County started testing more. I don't believe that we've seen that at this point. I think they said they were going to have all these tests available and everything. I don't know that they have necessarily just tested a whole bunch of other people at this point.
I actually was on a call today, and they had, they being KDHE's epidemiologists, actually had a reason for some of the spikes, and it was because some labs were smaller labs were not reporting necessarily on the weekends, so that's why the Monday numbers are so much higher. So they would get like batches of test results in, so it pushes that number way up high. It doesn't mean that there were only 20 one day and there were 140 the next day, but the reporting just kind of lags. You may have seen KDHE's update today. We don't have a positive case, and it's not because we don't have a positive case, it's because KDHE didn't get the lab result before 11 o'clock. So we do have a positive case, but it doesn't show up on the map because there's a lag. So that's part of the reason for those peaks and fluctuations.
There was a question about do we get a sense of how much higher our COVID numbers are as compared to the confirmed cases due to testing problems? So at this time, and I'm only speaking for Wilson County because people have asked, are we testing everybody that meets the criteria for testing? And the answer is yes. We do have ample testing supplies at this time. I'm not going to say we have excessive testing supplies, but we have been able to test the people that we need to test. Now, having said that, across the state, especially maybe in the Kansas City area or so, but although they, like we said, they're getting more testing supplies in, especially in other states, we are seeing that they might have somebody self-report that they have all the symptoms. They're very likely to have coronavirus. Maybe they came into contact with somebody who has confirmed coronavirus, and they then just tell them to isolate for 14 days. And so it really is hard to say how much COVID-19 is out there. We definitely aren't testing all of them and adding them to the confirmed case numbers. But a good chunk of them here in Kansas, I believe, are like most of them are being tested at this time and confirmed through our testing.
So Amy, moving home.
We need to know where she's moving home from.
Yeah, that's the question. That's the question I was going to ask. It depends on where you're moving from. If you're moving from one of the areas where there is community spread in Kansas, then we would love it if you would quarantine, but it's not mandated. Mm-hmm. And then if you're moving from one of the states that's under the quarantine order, like California, I can't remember.
From Joplin.
Oh, from Joplin.
Nope.
You wouldn't have to. No.
Mm-mm.
If you would, if you would like to, you can. It's always the safest option.
So, Eric, you mentioned that you heard that tested pregnant women in New York City and 88% of the women that were positive had no symptoms. It's probably like why there's a such thing as the man flu. Like we don't show any symptoms. I'm just kidding. Is that not the topic today?
No.
Okay. No. So, no, it's true. We don't know. I mean, we're just gathering all the data. We do know that pregnancy is still not considered a high risk state, and so it's high risk for like being uncomfortable and all that stuff. But it's not high risk for COVID. So it is. So the fact that we're seeing a lot of asymptomatic people, it just goes to show that this virus is tough. That's why it's spreading so quickly. Mm-hmm. So that's kind of that's our best answer for that. We don't have a reason for it, except that women are tougher. Okay, next question.
Okay. Yeah, Connie, how long does it take to get results back? We would love to say it takes 24 to 48 hours. That's not always the case. In this case, it took over a week. So I don't have a good answer.
We would like
we would love to say 24 to 48 hours. That would be really, really nice. If we could get to the point where that would happen all the time, it would be very nice.
And just like in this case, everybody, just as a reminder, everybody who, if your test is if it takes 24 hours or it takes a week, you still are in isolation during that entire time. So the health department is calling, checking on you. We know as your doctor that your test is still pending. Like, so we are on top of it every day, making sure that person is isolating, because it's mandated to isolate.
Yes.
We want that to be voluntary, but we can no one wants to, but you could potentially make it involuntary. But right. So your animals can get it too, right? So that is a question. So they actually, the reason I remember this is because there was a tweet that said, "Who let the dogs out?" And it's the World Health Organization, and saying that dogs aren't animals that can carry it. Now, having said that, lions, I believe lions or tigers?
It was tigers at
or
a
bears.
zoo.
It could have been lions, tigers, or bears, but I think it was tigers. So tigers, not the golfer, but the tigers were actually infected at the zoo, and so that was kind of a thing where we're like, oh, how did that happen? So it's possible. Just like, I don't know, if you can kind of like not love on your animal for a while, that'd be okay too.
Yeah, CDC's recommending you not kiss them in the face and let them lick your face and stuff like that, just in case.
We also recommend it because it's gross. Don't do it. And Bronx Zoo,
yeah, the Bronx Zoo.
So they isolate until the results are back. Absolutely. Yes. We don't. Once we test somebody, they're not doing anything else until the tests are back.
Yes, and if it's negative, then they're free to go about their business. However, assuming they're not running a fever, then we would always hope that they would stay home and not go to work, whether they're COVID negative or positive. But yeah, they're out of isolation if the test is negative.
And always remember that we've always done it like that. Like if somebody was sick, they don't go back to work anyways, right? So they have to be fever free. So because there's so many other illnesses that are out there still, we still would expect those people to stay home to, like if they're running a fever. I mean, if somebody had the flu, we wouldn't want them, visiting people in the hospital or driving around or, necessarily like coughing on things. So these ideas are not new. We're just being super vigilant. That's
Very
our new word,
vigilant.
Vigilant about it.
She doesn't let her dog lick her in the face.
That's good. Yes, don't let your dog lick your face. What do I have my dog for then? Marshall? I don't know. We don't want to know, actually. This is a family show. So, alrighty. Except if they've recovered. So they still stay in isolation, though, until the test. So the question or the comment was, if the patient meets that criteria for recovery, would they remain in isolation still until the test comes back? So we would probably actually recommend it still. I think it's like
it would
officially
be best. Yeah. Officially, I think that they could move about. I know that in places where there's noted community spread, where they're just asking people to isolate at home if they're not so ill that they need to go to the hospital, that they can finish out their isolation until they meet the recovery criteria, and then just wear a mask.
So it's kind of like we keep saying, when in doubt, camp out. Like if we're not sure, we're usually going to advise, like on our end, we're going to advise people if it's feasible, keep isolating, or if it's feasible, quarantine, and we'll help find ways to make that work. Mm-hmm. So, one request from our EMS crew and dispatch is that if you guys, if anybody's calling calling dispatch, calling 911, calling the police, calling the hospital, calling your doctor's office, no matter what you're calling about, please give as much information as possible, because they're going to ask you every time, do you have a fever? Have you traveled? Do you have any respiratory symptoms? So just be ready to give that information. And even if it's like, well, I went to Walmart the other day, go ahead and tell them that. Like, give them more information, because who knows, like, it might be 2 days from now and the world declares that Walmart is where coronavirus started. I don't even know. I mean, that would be the place, right?
Right.
But so we don't know. So give all the information that you can give, so that we can protect the people who are going to pick you up in the ambulance, or protect the people that are going to welcome you when you come to the hospital or the clinics, or the ER. We just need to protect ourselves, and then we can protect you and your loved ones as well.
There's a question, is the case in Wilson County a community spread, or is it the source known? So we've done contact investigation on this case, and we're still looking into the source. We haven't found it yet.
So, and then when we start talking about community spread, do you want to talk about kind of like definitions of, I guess? I mean,
we might as well. So community spread, I think it's too early to say that we have community spread in Wilson County. We have one case. Generally, community spread is when you have multiple cases and you have no idea where it came from. And
like so many that you can't just be like, oh, this person talked to this person that talked to this person, or not talked to, but hung out with this person.
Yeah. And honestly, to be honest with you guys, we're not 100% sure where this one came from, but because there aren't other cases in the county, my guess is that
it would be travel.
It would be some sort of travel. It could be travel to the county next door, but
we can't say it at this time.
Yeah, we really can't say that because we don't know.
See, look at us being honest. We will tell you when we don't know something, right? And that is our MO.
Yeah.
Hey, thanks for the thumbs up and everything. Look at you say. And then we did answer this, but we're happy to re-answer questions. If a person is recovered, are they at risk for reinfection? And so we don't know what the likelihood of reinfection is at this point. We thought initially that people couldn't get reinfected with coronavirus, but we are seeing that that's a possibility around the world, and so we just need people after they're recovered. That's why we recommend that they continue to wear a mask and be really careful about the people they're around, because we don't know. This is all new to everybody.
Yeah. Theoretically, you would have some antibodies, so you probably wouldn't get as sick as you did the first time. Just like, I don't know. I'm trying to think of, all I can think of is chicken pox, but you're not supposed to get that twice. But if you do get chicken pox twice, usually the second time isn't as bad.
That's true. That is a true statement. Antibodies, right? So people might hear about antibody testing, and we had a question about that earlier. So we are not doing antibody testing in Wilson County. Antibody testing isn't FDA approved, and we're showing that, I think they say something like 60% of the antibody testing is false anyways, or inaccurate, because it detects other coronavirus antibodies. And so just as a reminder, the whole microbiology reminder or whatever it is, so coronavirus is a family of viruses. And so the virus that actually causes COVID-19 is the SARS-CoV-2 virus. So if you guys remember SARS from back in the day, SARS was the SARS-CoV-1 virus. And so this is the second edition of it. It's a little meaner and a little deadlier. And so so coronavirus, people might have had coronavirus. It shows up on our normal respiratory panel. And most of the time, your average everyday coronavirus causes a cold, maybe a man flu, since we covered that already. But it causes a cold, and that's about it. Runny nose, cough, maybe fever, that kind of stuff. But this is a mutated version of it, and that's why it's deadlier.
Diane, if positive people from another county had contact with a person here in Wilson County, will Wilson County call or the other health department call? So that's happened. Mm-hmm. To be completely honest, the other county calls us. We use, and I know I've mentioned it before, we use a disease surveillance system called EpiTrax, and the other county puts the contact information into EpiTrax, and then they send it to us. And usually, because we communicate well, they call us too. And so we will probably call you. If it is a weekend, the other county could call you just because we're not necessarily in the office. And if they don't have all of our after hours information, they won't be able to get a hold of us because we won't be there.
So you'd call them on Monday.
So what we will call you as soon as we find out you are a contact.
Yes. And then is it possible tests aren't effective, or we have had false negatives? Definitely, we know that the false negative rate, the numbers are really varying. I mean, some people throw out 30%. Early on, they were saying it's only like 5 to 10%. We know that the swabs, and there are YouTube videos online, and so if you look at when a person is swabbed, it basically looks like it's poking into your brain and potentially out the back of your head. It goes way in there, and so if by chance somebody doesn't do it the right way, that can lead to more error and more false negatives. So if you were to ever get swabbed, be prepared to have your brain probed, and then just be prepared, because it has to stay in there for just a bit, and they do a little twisty, and then it's not fun for anybody. But it's important to get a good swab. But yes, so don't flinch, don't pull away. We want to get an accurate swab.
Yeah, and another reason that you may get a false negative that I didn't think about saying earlier is if the mail takes too long to get there, or the courier doesn't get there in time, if the temperature, they have to be kept cool. So those packaging things are also iffy, not as iffy as the swabbing.
The brain probing. Are you aware of any trends among those who are asymptomatic spreaders, i.e. more young, old, certain ethnicity, sense of humor? Yes. Thanks, Mike. I think the reason why we are so strict on schools, like for example, why schools are out or we're not in the buildings for the rest of the year, is because the young people tend to be more asymptomatic carriers. Usually, as we get older, we're going to show some sort of symptoms. So yes. Sometimes they have no symptoms at all, but they still can get the virus just as readily as someone else can. They just won't show it. Mm-hmm. So watch out for children.
Yeah.
In general.
That's why it's so sneaky.
Okay. Diane, we just want to point out that Diane has had no contact. But we'll make a public announcement. Thank you, Diane. Alrighty. What other questions do we have? Like while we're waiting, I feel like there might be some more out there. We do want to just remind everybody that the whole purpose of us doing this is just to make sure that everybody has all the information that you need and all the information that you want. Because just because we have a positive case right now in Wilson County, it's really no different for us than it was a week ago. And because we're all doing the same things, and we had to do the contact tracing and everything, but we're doing the same things that Wilson County has done so well for the last month, and that really has allowed us to stay free of the virus for quite some time. And so please keep doing that. That's our overall message, is that you guys are amazing. Our schools, our governments, our hospitals, our clinics, and our businesses, our churches, and individuals, like individuals are delivering meals to other individuals throughout our county just to make sure that those people who are having to stay home are not staying home and are hungry. So it's just amazing what's happening right now in Wilson County, and so please keep doing the things you're doing to protect each other in multiple ways. But the most important way to protect each other is by staying home.
There's a question about which hospital, and we're not releasing that. We're not releasing what community the person's from or anything like that. And there's another question asking if everyone who has the symptoms, regardless of how mild, if they're getting tested.
So I will say, I will say right now in Wilson County, again, just speaking for Wilson County, that yes, if somebody is coming in and we suspect them for coronavirus, if they have, so we're not testing in general, and we're not testing the public for if you don't have any symptoms. So, but if you do have symptoms and your likelihood, like let's say you were somewhere, or you think you were around somebody that had coronavirus. Even if we're not sure, we're trying to test those people. So we're at this point, we're not just telling people to go home and isolate, because if you do have symptoms, it would be isolation.
Yes, and I want to take this opportunity to put a plug into our self-reporting system. Mm-hmm. You can access that on both hospital websites, Neodesha and Fredonia City websites, and on the health department Facebook page. And if you have questions like that, like I think I have symptoms, I think this is where I got them, I will be honest and say if you have specific underlying health issues, you are more likely to get tested because you are more likely to have serious disease. But if you get on there, then that sends an email straight to the health department, and we definitely will call you back or email you and kind of get to the bottom of it, walk through it with you.
So Leslie, you're welcome for all the information you wanted and didn't want. We're going to spew so much information at you guys. You won't know what to do with yourself. You're going to have to take off your shoes and your clothes just to get clean from all the information also. Okay, and so there was a question right above that. Lori got here a little late, wanted to know why the tests are taking so long to come back. We just kind of mentioned they have to go to other testing sites. They may be far away. So when we send them to testing sites, they might go as far away to California too. I don't know that we mentioned that earlier, but they're anywhere from 24 hours to a week or more for the testing. We would like that not to be the case, but it's just the capacity of the testing facilities at this point.
Do we feel like now that there is a positive, we'll see more positives? We certainly hope not. I think, we've been waiting for this.
Not like wanting, but
not
waiting,
wanting, but we've been
anticipate.
prepared. We've been anticipating this. I mentioned to a couple of different people that every morning we didn't have a case. I woke up, I felt like I was in a twilight zone because I just knew today was going to be the day. So we hope that that's not the case.
You can see in the surrounding counties that some have, I mean, there are very low numbers in a lot of the counties surrounding us, too.
Yeah. There are a few places that have like facility outbreaks, like jails, you know,
it's tough, yeah.
all that. So those kind of places are a little more likely to have more cases. So I guess we'll continue to fight the good fight and try our best to stay away from each other, and hopefully that's not the case.
And we will tell you, again, we knowing we have our first case, we, like, the health department did an amazing job, and like everybody that needed to be involved in discussions were involved in discussions, and so we are trying to do all the things that we need to do to keep it at one person. So, and if it's two people, we want to keep it at two people. So we have no reason to believe that it's going to be just like, you know, widespread in the community. It doesn't have to be, especially if we keep doing what we all are doing. You're going to hear that a lot. It's really, we just have to keep doing what we're doing and be very diligent about it.
Do we end each broadcast with a dance routine?
You know, only on Tuesdays do we do the dance routine. Sorry, Mike.
Sorry, you missed it.
Out of luck. Janae, she used to work here as a pharmacist. She's just popping in to say hello. Oh, your accessibility is something to be envied. Thank you.
Thank you.
And thank you, Dr. Sevilla from Ohio, and thank you for all your support of Wilson County. He does a lot of podcasts and is on the news all the time in Ohio. So he's kind of a big deal. Teresa, your Wi-Fi. That's okay. We look weird when we
look funny when we buffer.
Yeah, we've been told by
I don't know
Karen.
if Karen is watching or not, but she's been sending us screenshots of our buffering faces, which are awful.
They're really awful. Yes, it contributes to our weird faces. So.
Yeah,
but we, like, any given frame, it looks like. Huh?
Yeah.
Oh, thanks, Alan. I'll do your hair anytime for your ponytail. All right. We'll do our last call, I guess.
Yeah,
right?
I think so. We don't want to take up a ton of your time today, but we knew there were going to be some questions, and we don't want I think like both of us posted, this is not a time for panic. We have been preparing for this. We've all been preparing for this for the past 5 weeks.
Probably. So I will say Destiny was on NPR because she was probably one of the most active rural health department administrators to be preparing for coronavirus, probably in the country. I mean, really. So even before it came to Kansas, Destiny was preparing, and so then when she's like, all right, it's getting closer, and I'm like, what? No. But no, we've been a great resource for each other. But I just want to put a shout out to Destiny and the health department. We have a health department of 4, but by golly, it's the mightiest health department out there. So I want you to know that we're trying to do our best. Again, this is our first pandemic. We're trying to make it up with the best information we have and relay all that information to you.
There's a comment that says, when you said that there could be false negatives if the mail carrier doesn't get there on time or temperatures fluctuate, then how are tests transported if sometimes going to California? By airplane? I mean, they have to be packed in a certain way, and they can get there fast.
Yeah. So it's not a common thing for.
No,
it's not like
they
they're
usually
just sitting
stay fairly close.
They're not like in the back of my minivan, like with all the other stuff that smells funny. They're like getting there as fast as possible. So that's a rare thing for it to happen, but it can happen.
Yeah.
What else is there? Awkward buffering. # struggle is real. So thank you guys. And really, we read these encouraging statements, and we appreciate it because we're going to say we need the encouragement. We're trying to do our best, and so thank you very much.
Yes.
So again, the biggest thing that we can do now is to keep doing what we're doing. Social distancing, don't have gatherings more than 10 people, and wash your hands, don't touch your face, 6 feet away from each other.
Masks.
Masks,
Please.
masks.
If you need cloth masks, I know people are making them. Cobalt actually retooled and is making masks. So if you need a mask, we'll
hook you up.
We'll try to hook you up.
Or
So
masks
if you are
plenty.
desperate for a mask, we'll do the best we can to help you out.
And really,
I even made masks.
and you can use just a handkerchief or an
Yes.
old T-shirt that you cut apart and just kind of like wrap it around. Anything works. It doesn't have to be fancy.
Yeah.
So.
Yeah.
All right. You guys, thank you so much. We will be back next Tuesday also at 5:30 at our usual time. We're going to keep you as informed as you'll let us, and we'll keep doing this because we just want to, we want to keep everybody on the same page and know that we're here for you, and we know Wilson County and everybody around us, everybody's doing their best that we can.
All right.
Okay.
Thanks, everybody.
Thank you.
You want me to hit finish?
Yeah.